George Grace is an accomplished artist. In March of 2016, he was diagnosed with stage 1 lung cancer, but wasn't away from his studio for long thanks to an old therapy being used in a new way.
I had the cancer therapy. The next month I was back and right back to what I was doing.
Grace is part of a clinical trial testing a treatment first used in the 70s. It's called photodynamic therapy. Researchers are now seeing if it will help fight the most common form of lung cancer called non-small cell lung cancer.
I'm alive today 2 years later and so far cancer-free.
The treatment uses a special chemical that responds to a combination of laser light and oxygen.
Immediately after the surgery is done, we then do this PDT or photodynamic therapy in the area so that if there are any tiny cells that you cannot see with the naked eye, that this PDT can eliminate those cells, can kill those cells.
Dr. Shumi Wogu is leading the trial and says PDT could be especially helpful for patients diagnosed at stage 2 or 3.
There's a higher risk in those patients to have microscopic disease left behind, okay? So those are the patients that will really benefit from this.
Dr. Wogu is cautiously optimistic. George Grace doesn't mince words about his feelings.
This clinical trial saved my life.
PDT is a complementary therapy used with surgery alone or in combination with chemotherapy and radiation. We'll have a link to more information on the clinical trial on king5.com under HealthLinks. For HealthLink, I'm Amity Addrisi.